Hey guys, this week I'm going to do something a little bit different than my typical Q&A. Just with everything that's been going on as far as a couple, some major figures passing away and a lot of people coming out and talking about health, especially heart health. It seems like I just want to do shed a little bit of light on it, give my take on it if anyone cares, and talk about a couple things that aren't commonly looked at as far as health checks goes. Because I think most people are getting their blood work done nowadays. At least I hope they are. And you pick up a lot of things from that, obviously, but there are things beyond that or other blood work um, tests that can be done that I don't think many people do or even have any idea of. And I saw a really good video from Dave Palumbo actually. I want to say it was this week. I think he put it out this week. It was one of his RX rants, and he talked about some stuff in there I thought was really useful. And I just wanted to kind of go into some things as well. So, as far as blood work goes, I mean, most people are getting their CBC, metabolic panel, thyroid, lipids, hormones, all that stuff. I mean, that's pretty common, I think. I mean, for most people. So, within that, I mean, there are some important markers right within that. And the major ones probably are going to be your hemoglobin, hematocrit, looking at blood thickness. Basically, is how thick is your blood, how much of these, you know, red blood cells and things of that nature. So if it's thick, donate blood. Most people know that. That's pretty common. I'm not going to go into that real far. Normally, if you keep up on your blood donations, most people are okay with those numbers and their blood doesn't get too thick. Um, there are obviously supplements and stuff that are gonna make it thicker, and you got to watch that as well. But for the most part, donating is gonna help keep those numbers in check. And then also on there, we're gonna look at normally your blood glucose is on there. Although I mean that's more looking at insulin sensitivity, but insulin resistance as a whole is definitely a marker for poor heart health and cardiovascular disease. So if you're someone who's chronically insulin resistant, it might be worth also getting your insulin levels checked, your actually fasted insulin levels, and see what those are at. That seems to be a pretty big marker for cardiovascular disease. I know I've had some discussions with my doctor about that, Dr. Serrano, and he's really big on that when people are experiencing chronic insulin resistance or might be prone to heart disease or things to get that level checked. Easy to do. You can get it right on your normal lab tests. Also, also on there, you're going to have, you have your liver and kidney values, and all those things are important as well. But typically, like I said, I'm going to stick to mainly heart health. And then going beyond that, there's some other things that I would like to look at. Typically, I like to look at the lipids, of course. Now, with the lipids, though, this gets a little bit tricky because typically most people are looking at as high HDL as possible and keeping LDL really low, right? So, and that's okay, I think, for the most part, but I don't like people to freak out if their LDL is a little bit high, if they have high circulating cholesterol. And what you eat in terms of cholesterol only has so much bearing on what your cholesterol levels are actually going to be. Your body regulates that. Your body produces its own cholesterol. Dietary cholesterol only makes up a pretty small part of that. So, excuse me, beyond that, looking at particle size. So if someone, let's say somebody that has pretty good HDL, like they get their HDL in a pretty good spot, whether that's 40 or above or 35 or above, and there's a genetic component there too, so keep that in mind. But their LDL is high. If it's high and you're worried about it, I would probably just get a particle size done. And if you look on something like Private MD Labs, that's going to be the NMR, is what it's labeled as, NMR and lipo profile. That's going to check particle size. What you're looking for is the big fluffy particles. That's what they typically call them, big fluffy particles. Those are the ones that aren't going to cause plaque buildup. They're not going to stick. Essentially, they're not oxidizing. Is what's happening. Is that the small hard particles are your lipids that are oxidizing, and those are the troublesome ones, and that'll tell you how big are those LDL particles and how much of them are oxidized and so on and so forth. It's not something that I'm not having, like, if I'm having someone do blood work, I'm not having them do it every single time, but it's something you might get done once a year or even maybe a little less often than that, just depending on what your situation is. But that's a good one to look at. And I have another video on my YouTube all about that. And I did it myself. I've done it a few times and showing you kind of what the test looks like and all that. So feel free to go on my YouTube. It's on there somewhere, and you can find it. And then, so going beyond lipids, I'm kind of going to get off your common blood test here. We're going to go into a few new things. CRP levels, homocysteine levels, a couple different vitamin and mineral levels, things like that. But CRP and homocysteine are two big ones. So CRP is a little tricky because CRP is a really good marker for heart disease, at least potential for heart disease or risk factor. But CRP is also a general marker. It's considered a general marker because it is picking up on basically whole body inflammation, but it seems to be pretty relevant to heart disease. But CRP is also an acute response protein. So what it is it's a protein that's released from the liver in response to inflammation. So if you see a high CRP level, then that's probably inflammation. And like I said, it gets tricky because it is an acute response. So it can be released in response to things like infections, and if you're really sick, and injuries and stuff like that. But if you have it, if it's chronically elevated, then that's an issue. That's normally a sign of something deeper and something else going on. And it's heart disease, like I said, is a pretty common one there, but it can also be indicative of things like cancer and other diseases, lupus, autoimmune stuff. And then, but you have to look at too, you would look at other tests that were connected with it, So if it's heart disease, would you look at other things like looking at your homocysteine levels, looking at your lipid particle size, looking at your blood thickness, see what markers are attached to it, because since that's a general marker, you would want to look at what other things that are non-general, that are more specific, are attached to it to kind of give you an indication of what that inflammation means. And that's one of those things. If it is elevated, then you should probably retest it. Wait a little bit and retest it again, because like I said, it can be an acute response. So you just don't. It's hard to say exactly what it's from. Now, if you're retesting it, and you're noticing, oh, it's not changing or it's still pretty high, then you probably should investigate because it should go down if it's an acute response to something that's just just happened, like the injury or the infection or whatever. So that's a really big one. When you look at the blood test, there's going to be a high sensitivity version. That's normally what's recommended, just a little bit more accurate. So homocysteine levels, that's basically an amino acid that's going to be in your blood. You get that from meats and milk, mainly meats. But typically when that's elevated, that's also a response to that's also an immune response. So with that, that's typically another marker for cardiovascular disease. But that one's a little different in that it can also mean anemia. And when I say anemia, I'm talking about usually specifically pernicious anemia, so vitamin B12 deficiency, sometimes folate deficiency. You have a methylation process. That's basically B vitamins. They have to be. Let's look at B12 for example. There's an intrinsic factor in your body that's going to make sure that the B12 is basically converted into an active form that your body can use. So if it's not, you'll become anemic even though you're consuming the B12. It's just not, it's not absorbing. So a lot of the time, if somebody has, for example, like a really high homocysteine level or just a high homocysteine level, you could maybe look into increasing B vitamin supplementation, especially methylated B vitamins, and those are basically just the active forms of the B vitamins. There's a lot of products out there. Jarrow makes one, Life Extension makes one. I think there's one called Seeking Health. That's homocystex X plus some shit like that. So, but there's a bunch of them, and normally if you can get folate levels up and get your B12 levels up, then that can help with that marker. So those are two things: the CRP and the homocysteine levels that I would personally look at. Like I said, maybe not all the time. Kind of like the fasting insulin, maybe not all the time, but periodically. If you're getting your blood work twice a year, maybe look at those things once a year. Something like that. That way you have a benchmark. And then when you go back and check them, at least you have something to compare them to. Um, and then again, the lipid particle size, so that NMR profile, that's another good one to look at. So those are, let's say that's one, two, three, four different things that most people probably don't look at that are definitely useful. So I think beyond that too. There are other tests beyond that. You can go into things like into your scans and your EKGs and your ECG, EKG, your CT scans and things like that. So as far as the scans go, that's going to kind of depend on the person and what they need. And any of this stuff, you should talk to your doctor about this stuff. If you're looking at markers that are consistently off, you need to talk to your doctor. You can figure a lot of stuff out on your own, and that's fine. But you should definitely be talking to your doctor, because if you need any scans like this, they're going to have to give you a referral, and those are things you need to go over with them and not necessarily try to take into your own hands. So as far as the scans go, like I said, that's going to kind of depend on your specific situation and kind of what your risk factors are, and symptoms if you have symptoms. I know one thing about them too is that ECG is a common one. And I know a lot of people will use that and they think, oh, my electrocardiogram is great, so I'm good, my heart's good. And that's really a pretty lousy marker in my opinion, at least from everything that I've read and the research that I've seen. It's just a really lousy marker because it's basically measuring rhythm through electrical impulses from the heart, and it just doesn't seem to connect very well to actual cardiac events. The amount of people that it actually helps, the percentage seems very, very small. So that's not to say that it's useless, but I don't know that that's the one that I would put a lot of merit into. If you're someone that has weird heart rhythms, you're all of a sudden your heart just spikes up like crazy and it blasts into 200 beats per minute or something from resting. Yeah, that's probably worth checking into. But for the most part, I think there's some better tests. There's like CT scans, ultrasounds, things like that, where they can actually look at the walls of the heart, look at how things are shaped, and how the blood flows through it. And tests are different. Some of them are a little more invasive, where they'll actually need to, like the catheterization, where they'll go into you actually go into the arteries and put the dye in and look at what's inside, as far as like how everything's flowing through. And that's going to be a little bit more invasive. They got to actually put the IV and all that junk in. But like I said, these really aren't things to take lightly. So if you're someone that needs scans, you should. And even if you don't think you need scans, I think it's good, especially after a certain age, that just have these things checked out. Most doctors shouldn't give you problems about it. If they do, that's I feel like you should probably switch doctors. So main things there, going back. Lipid profile, and the main things that aren't commonly talked about: lipid particle size, homocysteine levels, high sensitivity CRP levels, heart scans. So some of the heart scans we're talking about. And what was the last one I talked about? I feel like there was one more. Maybe there wasn't. Maybe that was all of them. But yeah. Get those things checked, guys. If you don't normally, if that's not something you normally check, get those checked out. It's very important. Get your scans done. Keep track of your blood pressure. Realize, too, that some of these things, like I said before, are genetic. There are a genetic component. So just because you have your regular heart rhythm and... Oh, say hi. Ooh. Just because you have your regular heart rhythm, or you have some kind of problem with one of your arterial walls, or the size of your heart, or blood pressure, HDL levels, it doesn't mean you're necessarily doing anything wrong. It can just be genetic too, so don't fight it. Get it fixed. And I think that's it. I had some notes here, make sure I covered everything I wanted to cover. I did make a couple notes this time, which is weird because I normally don't. Yeah. Those are the main things, guys. And of course, keep getting your hemoglobin, hematocrit, lipids, all that good stuff. Fasting insulin, that's the one I forgot. So make sure you're also checking that out. And if you guys have any questions, just let me know in the comments. I know that was kind of scattered, but I just wanted to throw those extra markers there out at you guys, and hopefully some people actually check into those because you probably should. Thanks, and talk to you guys later.